Hello, everyone, and today is a great day for 5 minutes because I have Mary Crowe, and everybody loves and knows Mary Crowe. No, but nobody loves and adores Mary Crowe more than I do. So, welcome to 5 Minutes with Mary Crowe of Care Dimensions. Hey, Mary.
John, so much. Thank you for the kind words.
Uh,
Usually, you're wonderful, and I thanks so much for having me on your show here.
my
Having
pleasure.
This is wonderful.
My pleasure, Mary. So, Mary, why don't you tell us a bit about Care Dimensions and your role over there?
Yeah, I will. My title is Director of Professional Community Education. I'll tell you a little bit more about that in a few minutes, but let me tell you about this great organization that I work for and have worked for the past 14 years. I'll tell you this. I hope by now most people know about or have heard Care Dimensions, but we're the largest hospice, John, in the state of Massachusetts, our largest provider of hospice and palliative care. We're a not-for-profit hospice, and we've been caring and supporting hospice patients and families for over 42 years. Can you imagine?
That's a long time.
Yeah, and I use the words caring and supporting because the hospice team consists of so many people. We do so much. So, we have physicians and nurses and social workers and chaplains and hospice aides and volunteers and a whole array of complementary therapies. And we support patients and families around the clock, John. It's, we're there 24/7. And it's just such a wonderful thing because, a lot of times people aren't able to say those things, that they have access to that kind of care around the clock. So we also have two hospice houses, inpatient facilities, which some people might not be familiar with. So we have the Kaplan Family Hospice House in Danvers, and we also have the newest one, which is the Care Dimensions Hospice House, which is on the Lincoln-Waltham line. And both of these houses are utilized for individuals who meet general inpatient level of care, hospice guidelines. And sometimes, people don't understand what that means. But, in order for individuals to qualify to go into one of the houses, they generally have complicated pain or symptom issues that are really, again, making them eligible to go in to have that. We have a large service area, John. We take care of people in cities and towns throughout eastern Massachusetts. And that includes the Merrimack Valley, the North Shore, Greater Boston, Boston, Metro West, parts of the South Shore. So we cover a huge area. And we also have palliative care. And a lot of times, people are like, well, what is palliative care?
Right. Yeah.
John, what is that? So people might be asking, what is palliative care? So palliative care is for individuals who have a serious illness and who need assistance, and they can need assistance around pain or other symptoms, or even around goals of care conversations. So palliative care is such a wonderful, wonderful resource for people. But these people are generally not quite ready for hospice yet. So, you can utilize palliative services, and it does such an array of things. So, the nurse practitioners will go out and they collaborate with the patient's primary care physician and make recommendations around medications and other things for symptom management. And people who are receiving palliative care, they can actually receive curative treatments. And they don't have to have a terminal diagnosis, which you often hear around that 6 months or less time frame for people who are on hospice. So none of that applies. So palliative is a wonderful resource as well.
Right.
We also have a new member, the newest member, John, of the Care Dimensions continuum of services is our Home MD program. And I don't know if you're even familiar with this.
Little bit.
Yeah, so this is great. Our Home MD provides primary care services in-home to patients 65 and over. Yes, doctors still make house calls, John. Just when you thought it wasn't true.
Just when I thought it never existed, yeah.
So our Home MD program ensures that patients who have difficulty leaving their homes benefit from that personalized medical care, no matter where they live. Whether it be in their private residence or home or assisted livings or facilities. So this has been great. So it's ideal for people who are physically fragile or even suffer from memory loss, John. It's been a wonderful thing, and it really helps people to manage these chronic conditions. So the Home MD program, there's years of experience in here caring for elderly patients in their home. And so that's kind of our array of services. We do so much, John, and you know my role here is the
Right.
director of professional and community education. And
Right. So I am hashtag the locator. You are hashtag the educator.
yes, and I'll tell you, I think the list is extremely long, John, of the things that I admire about this organization. But one of them is their knowledge and their understanding of how important education is, and how it really impacts the quality of care people receive. And that actually impacts the quality of life for the people that we care for. So, I'm out there, as you know, doing, all kinds of things. So we have the Learning Institute, the Care Dimensions Learning Institute, and that's kind of where I am in terms of getting out there. And, the Learning Institute, we want to, educate, enrich, and empower people. That's what our goal is to doing. And it really, this is about how these evolving needs for people with serious illness and other issues. So, and this is for individuals and families. So I go out and I do a lot of education to not only professionals, but also to community members, and particularly around topics around advanced illness and end of life.
That's terrific, Mary. So you've got so much happening with yourself personally with Care Dimensions and at Care Dimensions, hospice care, palliative, doctors making house calls, and your whole comment about the educational part of it. Empowerment through education is so key in the world of health, because it can be very complicated and very emotional. And the more people learn about choices they may have, things that they should ask, or just their specific situation they're living in, the way better off they're going to be.
Oh, absolutely. You're absolutely right, John. People have a right to take charge. They're driving the bus, as I say, right?
Right.
A right to take charge of their own healthcare wishes. And I'll tell you, certainly at Care Dimensions and through our hospice and palliative care teams, we focus in on that individual and the family, the whole system, in terms of making sure that people's wishes are heard. So it's about understanding a person's illness, and it's about them really understanding the benefits and burdens to treatment, but also understanding what are their priorities and how do we align that treatment to their priorities. And with that focus, I'll tell you, really, it's very individualized, and there's no cookie cutter stuff going on, John.
No,
This is that person and the people who love them, and how can we help enhance quality of life for whatever time a person has left.
Yeah, no, that's great. Mary, thank you so much. So tell us, how is the best way to get a hold of Care Dimensions, or if professionals or education centers want to learn more about some of your programs you offer?
Sure. Yeah. Anybody can inquire about our service. They just need to call our main number, day or night. They can call, right, any day or time of the day or week. The number is 888-283-1722. And they can get me a message too, John, if they have questions around the educational component, but certainly any questions about any of the services that we offer here, they call that number, and we have somebody answering that phone. It's not an answering service, John. We have actual clinicians and people answering those phones, so they'll make sure that whatever the question is, that it gets to the right person.
Terrific, terrific. Mary Crowe with Care Dimensions, thank you for the 5 minutes. And
John,
before I sign, my sign off is going to be keep calm and crow on.
oh, I love it, John. I love it. Thank you so much.
Thanks, Mary. Have a great day.
You too, John. Take care.